Culasi Elementary School SBM Wings Rationale and Overview. To strengthen the implementation and compliance of schools to DepEd Order Number 10, Series of 2016 entitled Policy and Guidelines for the Comprehensive Water, Sanitation and Hygiene in Schools or WINS program. Culasi Elementary School addressed this challenge by improving the poor sanitation practices among school children by giving them an adequate water supply, adequate toilet, and proper hand washing facilities to achieve hygiene and sanitation. Hygiene and sanitation are essential to good health. With this, pupils were given an orientation on proper and correct practices in the use of these facilities and were required to practice such to maximize the benefits and achieve the impact to the well-being of the community. Apart from hygiene and sanitation, the schools also conduct semi-annual deworming for kindergarten and elementary school pupils, with combined daily toothbrushing and proper hand washing under one program. Pupils have been taught simple, basic, and doable health interventions, and that also includes proper garbage disposals to promote cleanliness and prevent sickness. Culasi Elementary School also partnered with stakeholders to vigorously promote correct hand washing practices among school children. To expand, the school has crafted holistic programs and guidelines for personal health care and environmental sanitation through a set of standards for proper and correct health practices in schools. It goes beyond proper food handling, hand washing, toothbrushing, and deworming. Hygiene includes menstrual hygiene management, health education, and capacity building. In crafting this set of guidelines and in partnership with agencies and stakeholders, it addresses the gaps in the areas of hygiene and sanitation and keeps more children healthy in school. Culasi Elementary School believed that healthy children and healthy environment improves its operating efficiency and upgrade education quality. Based on the results of the 3-star approach, these were the critical needs of the SBM implementation. Culasi Elementary School was not subjected for water testing under Metro Rojas Water District or MRWD. It is considered as one of the school's critical needs in terms of water. In terms of sanitation, Culasi Elementary School, based on the overall pupils' toilet seat ratio, were lack of separated toilets. Collection of garbage in school, based on the daily basis collection, was not properly followed, which resulted to burning of garbage. Food handlers in schools were not properly oriented on the correct handling of food. In terms of hygiene, Culasi Elementary School lacks funding for the supplies and facilities for hand washing and toothbrushing. Thus, some of the schools had been identified as high in the deworming program. In terms of health education and capability building, coordination and wide dissemination of SBM WINS program was not tackled in most of the schools. Water. Culasi Elementary School provides regular supply, safe drinking water, and usable water. Request letter for water testing were already sent to the MRWD. Sanitation. Renovated functional toilets with individual hand washing facilities. Teachers conducted proper orientation on the operation, use, and cleaning of school toilets for health and hygiene needs that are gender segregated as applicable to age group. Practiced proper waste segregation by providing separate garbage bins for dry waste, wet waste, and hazardous or toxic waste, as well as proper solid waste disposal through the existing municipal or city solid waste management and disposal system, or in the absence of the same, through the compost pit within the school premises. Hygiene. Implemented and supervised individual and group daily hand washing activity with soap and daily toothbrushing with fluoride toothpaste. Coordinated with partners or stakeholders that shall provide adequate group hand washing and toothbrushing facilities. Deworming. Dewormed all students biannually subject to DOH recommendations based on the results of the current prevalence index survey. Strict implementation of deworming program with parent consent. Health education. Conducted orientations or trainings for the WINS program for school WINS coordinators, teachers, health personnel, and other stakeholders in our school. Integrated WINS program into teachers' daily lessons in our school. SBM WINS implementation, best practices, and innovations. Water. Sanitation. Hygiene. Deworming. Health education. Insights and lesson learned gained. Taking all necessary measures to ensure strict but effective implementation of the school-based management WINS program in our school, and by giving new insights and sharing of knowledge and understanding among students related to effective hygiene and sanitation practices through effective program management, and by engaging such public and private partners for program implementation and sustainability. The schools achieved its goals for learning and health outcomes that also includes the improvement of school attendance through a simple, sustainable, and scalable school-based water, sanitation, hygiene, and deworming program. Future plans to sustain SBM WINS implementation. Water. Culasi Elementary School must conduct water testing at least once a year to ensure safe drinking water of the pupils. Sanitation. Provide additional functional toilets to be used by the pupils to ensure the safety of the pupils, especially the girls in school. Prohibits the burning of waste. Environmentally, poor waste management can cause air, land, and water pollution that can harm our pupils. Add functional washing facilities. Enough washing facilities could make every child wash their hands properly at the same time. Hygiene. Conduct group hand washing activity with soap. Children learn a lot from each other through groups. They can observe each other if they wash hands together. Ensure daily group toothbrushing. This is a good way to make the pupils enjoy toothbrushing by observing, motivating, and learning if they brush their teeth together. Adequate supply of toothbrush and toothpaste. Every child can brush their teeth even when they are in school. Having their own toothbrush encourages them to brush their teeth regularly before and after eating. Coordinate with external partners and encourage them to provide adequate supply of soap, toothbrush, and toothpaste to ensure school's strong implementation of SBM wins. Inset. Hand washing education would be included in-service training so that it will be strongly implemented, promotes, and advocate in school. Segregated trash bins so that the children will be exposed on how to dispose waste properly and to educate the pupils to reduce the amount of waste. Garbage collection. Collection of garbage should be done every day to reduce garbage that are hazardous to children's health. Thank you so much for listening.